Welcome to the Our Forever Smiles podcast, a podcast created to support mothers of children who were born with clefts and those who love them. I'm your host, Laura Arroyo. Hello, and welcome back to the Our Forever Smiles Cleft Mom Diaries and Support podcast. I am Laura Arroyo. Before we jump into this episode, I would like to invite you to join this community to hear conversations with other cleft moms and advocates that will help you feel supported along your journey. All I want you to do is click on the follow or subscribe button. We love your support and we want to see us all come together. So just thank you so much for subscribing. We have so much in store for you this year. As a note, we do have a medical doctor on the podcast today, but he is not your medical doctor, and we do not intend for you to use the information that we share here as a diagnosis or any medical advice. We are just parents and advocates and professionals who love our children, and we are sharing our own personal experiences. Today, we have Dr. Law on the podcast. He is a pediatric and adult plastic surgeon who cares for cleft-affected patients in Dallas, Texas. He is director of the International Craniofacial Institute at Medical City, Dallas. Welcome, Dr. Law.
Thank you. Thanks so much for having
me. I'm so great. Well, first, before we started recording, I shared that I reached out to Dr. Law and I really wanted him to come on the podcast because, of course, we love to hear from cleft moms, but we like to hear about the medical and scientific parts of cleft as well, and just what to expect from this journey. And he scheduled right away, which I'm sure he's really busy, and I just am so grateful for that. So just want to thank you for your willingness to come on, but also
I was super excited because there's such a feeling, I think. I talk with families and so often they say, they felt so alone, and they don't know anybody else who has a child born with a cleft, or they unless there's somebody, like some parents come in, actually they had a cleft and they've kind of gone through their own journey, but then they themselves sometimes don't have other people to talk to and say, as a parent, you're like, hey, is this normal? And then as a parent of a child who has a cleft, you're like, no, really, like how normal or not normal? Like, are they feeding well? Are they breathing well? Like, is this, is this a tooth? Is this not a tooth? There's just so many questions and worries and anxieties as a new parent. And then you stack on it, anything, like any sort of difference with a medical condition or additional doctors, like it can be tough. So the fact that you're putting the stories out there, right? You're building the community. There's the awareness. There's the education. I think it's super important. When I've been to different camps and get-togethers, that's always been the biggest impact, I think, is when the parents get together. One, the kids get together. When the kids get together and they see each other, hey, like I have that same hearing aid, or hey, we look the same. We have, we're so alike, and they're offering us kids, and then the parents sort of, their shoulders can relax. They're not worried about anyone saying anything, and then they start sharing their journeys, right? So there are some families that are right at the very beginning. There are some families that are kind of in the middle of just teenage years, which have their own issues, and then you add the cleft stuff on top, and then you have parents on the far side, right? You have parents who now have kids that are adults that are off, like living very normal lives, doing, going to prom, getting jobs, like having grandkids of their own, and they're able to share, kind of that whole journey with one another. So I think this is super cool, and that's why I was so excited.
Hi, I am so sorry to interrupt the show, but I just want to tell you about today's sponsor. Today's show sponsor is Sienna Media Integrated Marketing Agency. Sienna Media is more than just a marketing agency. They are your partners in progress. Their mission is simple: to alleviate marketing bandwidth, allowing creative business owners to focus on what they set out to do: create. Sienna Media empowers creatives to thrive without the burden of managing their own social media and marketing campaigns. Visit siennaDawnmedia.com. Thank you. Thank you for that. Why did you choose craniofacial surgery? Like what drew you to that specifically?
Yeah, I mean, I would say, I was thinking about it, if I won the lottery, I'd still be doing this, like I don't love everything about it, right? Like if I could not deal with insurance companies ever again, that would be a major win. But in the end, it was a combination of something I really enjoy, something I'm good at, and it's useful, like for people around it. And so, like when I say like I enjoy it, I mean like I'm really really passionate about it. Like this is what keeps me up like at night too late, like listening to podcasts and like reading stuff, and it gets me up in the morning. There's nothing better, I would say, than helping somebody, helping them grow, seeing them get better and stronger and thrive and really come into their own. And so I almost became a pediatrician because I love the
Mm.
process of like, as a parent. So I'm a parent, you're a parent. So, like your kids are so precious, right? Like your child is just really like the world, right? And so, for so many people, for them to trust us, with being involved in their kids' care and to be able to help other people's kids, to be able to help these kids, live like a healthy life, or to help them with questions or struggles, so much I find is beyond surgery nowadays, right? Like we have these cleft visits, we see patients every year, and I spend way too long in the rooms. Like we had a 6-year-old here yesterday, and she was telling me like knock knock jokes, and
Oh.
I was just eating it up because she was living a very happy, very vital. I don't know, just it was just such a magical human thing, with nothing to do with surgery. Like it's just like the person to person connection that is like so important, and just being able to uplift and teach and empower the families and the kids is amazing. So yeah, I've thought about it, like the job satisfaction. Okay, like I read about job satisfaction. You think about like purpose and passion. Like that's like one big piece of it. One of the I think three one of the three big ones I think was passion. One was mastery. So it's something where like you're challenged, right? There's
Mhm.
something that maybe is hard, but it's hard in just the right amount that you can see yourself getting better. Like you're not drowning. Sometimes it feels like it, but every day it's like you with the podcast. Like from your first podcast to your 20th to your 50th, you look back and say, "Man, I'm doing these things better." And then there's still that time like we'll be done with this conversation, and then you just say, "Oh man, I wish I would have said this, or I wish we would have done this thing different with the microphones or whatever." Right? So like that's the same thing with medicine. Like not just as a surgeon, but as a communicator, as a teacher, as a counselor, as a boss, like as a husband, like all these things. But specifically as a doctor, there are just so many things that I can do better, and that's part of the social media stuff. When I started doing more beyond before and afters, and doing more teaching and doing more trying to educate the community, a lot of that is I feel like I'm finding my voice, and I'm getting better at it. So that's been super fun. And then the last one's autonomy. Like that was number three. Is like no one likes to be micromanaged, and so plastic surgeons are on the high end of like we have so many choices. Not just like the small ones. Like you can pick, oh, do I want to use this stitch or that stitch, or do we use 2 stitches or 3 stitches? But like as a field, we train in cosmetics, we train in breast and body reconstruction, we do kind of tumors and trauma, and like a quarter of our time is doing hand surgery, which no one like really knows about. But we have all these things that we could be choosing to do. And then when you look at surgeries, I know you've talked with other people, like some people do their cleft repair at like 3 weeks, and some do 3 months, and some are doing like 1 year. And like there are big picture things too, like how do you choose what's the right thing for you in your mind, and then for this family and this person, because everyone's all unique. So again,
Mm.
three things, like the purpose, the mastery, the autonomy. And then we could even go further back, but I love it kind of developed from getting into medicine and then seeing the impact you can make with plastic surgery. And then specifically, I've always thought kids are just the best, the coolest, you
Yeah.
so
That's
helping.
interesting. Yeah. What is I'm thinking like technical too, but like what is the hardest part of about being a cleft surgeon? Like what did you find most challenging?
One of the hardest parts in general is so much of our advice and our techniques and everything, so much is experience,
Mm.
because there's not a lot of good research out there.
Really?
People try to do research, but then at the end of the day, like you're not going to have like two identical twins, right? And then you'll
Mm.
do one thing for one twin and not the other twin. So you're comparing a lot of individual kids and grouping them together. And so people have done studies all over the years. There was like a Eurocleft study back 30 years ago. And they found that one of the big differences is just, doctor to doctor, there's a big difference, even if you say you're doing the same technique. But then you look and they say they're doing the same thing, but they're actually doing like a lot of different stuff. And so
Mm.
I'd say that one is probably difficult, is that there's some consensus, but there's always new stuff coming out. I'd say even harder really is the like social and emotional side. Okay, because like surgery, we can do a lot of things to help repair muscles, physically help with the clefts, but that's a few hours, a few days here and there. Like, but really, like the bigger part of your life is like, how are you interacting with the world? How do you see yourself? Like, what's the voice inside your head? What are you telling yourself about this thing you were born with? And then how do you
Mm.
move forward and get to that point of acceptance? You say, okay, this is part of who I am. Like I love who I am. So almost
Mm.
part of that is like at some point people end up falling in love with their cleft and their kind of the journey that got them to where they are. But it's a process for everybody. And so like one of the things we're working on is different things we can do to help families, right? So from the very beginning, if you have a newborn and they're going to like daycare, right? Like what are the things that you can help tell the caregivers, to teach them about it, because they might not have ever seen a baby who's
Mm.
born with a cleft, right? And then one of the really cool things we're working on is like that school age, right? Like before kids hit about second grade, they're super curious. Like about second grade, kids start like kind of judging more and like teasing or like kind of like needling a little bit, right? But before that, like we have an elementary school teacher where we are, and he has snakes and bugs and all these things that all the adults, sometimes are like unsure about or kind of give some space. But before, when the kids are like kindergarten, first grade, they come in and they're all about it. Like they'll play with the snake,
Mhm.
they play with the bugs, and so some of it's exposure and education. And so one of the things we're doing is, we give parents sort of a go-to kit, right? So that you can go in at the start of a school year with a kindergartner or a first grader, they're starting, and you don't know what's going to happen with your kid, because it's like giving your doctor over to or giving your kid to the doctor when they go to the operating room. Like you hand over your kid, and then like it's out of your hands. Like you just
Yeah.
don't know. It's a very emotional time when your kid goes off to school for the first time. And so to be able to educate the people around them and say, hey, like we're all born different, right? Like some people are taller, some people are shorter, some people have like curly hair and straight hair, and like it's an interesting thing. Like it's a cool and curious and interesting thing, and we all still love to play together and hang out together and like learn together. And so it's a little bit of that education piece. If you've ever read Wonder, have you seen that book or that movie?
Mm-mm. No.
It's one you should put on your list. The movie came out about 9 years ago. Julia Roberts, Owen Wilson.
Oh, I
Uh,
love Julia Roberts.
yeah, but it came. The author talks about it, where I think she was in a situation where she was at like a grocery store, I think, and her kid said something about a child with a craniofacial difference, and she didn't know how to respond, and so she was embarrassed, and so she
Mhm.
like grabbed her kid and ran away, and she felt really bad about the situation. So I think later on, I want to say she educated herself about it. She ended up, becoming an advocate, and wrote
Mm.
a novel that then turned into a great movie. The book's great, and I mean it just touches on like education is so important, and exposure, and just normalizing it. One of the other things I learned recently was that like clefts really in media, it came about in silent movies. So when
Mm.
they needed to show somebody was different, was a villain, they would give them like these scars. And so it's something that's kind of been perpetuated. You have like Lion King, you have Scar, like
Mhm.
sometimes these things just get into the subconscious, right? And so part of it is changing the narrative, kind of changing people's the environment's perception so that like people don't have to fight so hard through their day-to-day interactions, their day-to-day struggles, because everyone, like we talked about, everyone already has so much on their plates that
Mhm.
if you can take one thing off, like what a godsend, right? Like so. Anyways, that's one thing that we're doing with education and trying to help families.
Yeah, what do you think is, your favorite surgery to do?
Favorite surgery? Yeah, I mean, um, it's. I think most cleft surgeon would say that that first primary cleft is super satisfying from just the amount of difference that you make from the very beginning,
Mm.
right? Like you
Mhm.
start with something very visible. The first time I was exposed to plastic surgery was actually a guy who was falling. He fell off a ladder, and he said I could either fall to my right, where my son was at the base of the ladder. That's probably why the ladder wasn't very. He threw himself the other way, and he went through a glass table. But he cut a tendon. He cut a tendon in his hand, and so then the plastic surgery resident actually came down, washed it, and fixed the tendon. So he goes from like he can't bend the finger, and then all of a sudden, oh look, I can bend my finger. And, the resident's like, don't do that. You have to let it heal. But it's something where there's an immediate. There was a problem, and then now you've made a big change, and it hits all the points of it's not just a now thing. It really is a forever. What you do now has such a big impact for a lot of reasons. I couldn't do kind of ICU end of life type things because it's so
Mm.
sad to me. But part of it, why I love working with kids, is like everything we do, it multiplies and it grows and it's got such a huge impact. And it's the other things too. Like you have a lot of choices. Everyone's a little bit different. So the whole time you're actively thinking about what you're doing and why you're doing it. And then every time you look at it, you say, oh, well, I wonder if I could do this a little bit better next time, whether it's,
Mm.
just there's always like little things that you think, oh, maybe this could be different. And we
Yeah.
yeah.
That's the kind of annoying thing about Clef though too, because it's like, well, among many things, it's like it's so case by case, and like now that I have a better understanding of it as myself, there was a lot of like that initial meeting that I had with our surgeon. It was like, well, we'll see. Like I'm like, is she gonna have any speech issues? We'll see. Or like, it's all like kind of this waiting game, and like and we'll see, and it's always like, as you've shared, it is like case by case basis, and so many people are doing different things for different patients.
Yeah.
And I mean, it's
Yeah.
one of the things that I think is like kind of frustrating. So what is that for you and your patients, that initial meeting? Do you see mothers and families like prenatally, or
Actually,
it,
pretty fun. We just visited with the maternal fetal medicine program here, and they have these new ultrasounds that actually can see a cleft palate. Like the historically, maybe you'd see the lip and the nose, but it was
Mhm.
hard to tell. So for some families with a cleft palate, in the family, then they'd say, "Oh, we're having another kid. Would be interested just to see, but before you're born." And so one of the things we've talked about is setting it up so that with the NAM, which I know has been a point of discussion quite a bit. But the NAM, instead of having to wait for the kid to be born and then you do like the mold, the impression and the cast and everything,
Mm.
we could do it from the 3D scan. You could do it from the ultrasound. So like day one, your child is born and then we put the NAM straight in, and then you don't have to do those extra steps. Uh,
Yeah.
so we've talked about like a bunch of this sort of thing, but yeah, it is hard because we want to give answers, but some of these things are so like case sera sera. Like we don't know. We know. Say like 1 in 5 people might have this, but are you in the one or are you in the like the four? Um,
Yeah.
and we don't know, but once it happens to you, like, then it's 100%, right? Like, if you are
Mhm.
that 2% that's gonna have an infection and all of a sudden it happens, well, it's 100% you're dealing with it and we're dealing with it with you. But that's probably one of the hardest parts is, sometimes you can do everything right, we can do everything right, and still things don't turn out exactly the way you expected it or wanted it to.
Yeah. We talk a little bit about the schedule. What is your schedule? When do you do lip repair?
For timing for the surgery,
Yeah.
yeah, I fall probably in the middle of the bell curve where tried and true would be about 3 months old. I know one of the other doctors talking about rule of tens. That's a good rule of thumb or kind of a good baseline rule that we think about sometimes. I know some centers are doing it sooner. For me, I'd say what shaped me a lot was during COVID. So during COVID, a lot of people didn't want to stay in the hospital. So we were setting it up for patients to be able to go home the same day. But there's a kind of a threshold right at about 52 weeks. Okay, so you're born typically, around 40 weeks, but if you're preemie, you have to account for that. But at about 52
Mhm.
weeks, there's a change in the risk for breathing problems after anesthesia. So before 52 weeks, we have a policy that mandatory kids have to stay in the hospital because they need to be monitored overnight to make sure they're not going to hold their breath, essentially, like their brain's just not sending enough signals. But after that mark, we could do the surgery and actually send patients home the same day with their families. And so it became a thing where part of it was you're not losing really anything by waiting, other
Mhm.
than parents have a couple extra months, 2, 3 months to like fall in love with their kid, and
Yeah.
then all of a sudden you have the surgery. But I think it's a good time, at least in my mind, that the kids can get bigger, they can get stronger, parents can recover some. Um, you know, Having a baby and then having a newborn already is so hard, and then to be able to get everyone going on the right path. It gives time for NAM, if that is the right answer or not, and then you still have time to kind of recover and then go on and do the palate later. Um,
Yeah. Yeah, I've people talk about, I think it's a hospital in LA, what is it?
yeah,
CHLA that does the early repairs, and it's very controversial among the community, I will say.
yeah. I mean, you can. It's like some things where if you're, differentiating yourself, it is sometimes people will be pulled to this different option, right? And I think they've done a lot of research that says, it is safe. And they have good outcomes. Like any other research, there's always little questions that you have about, how much is because of this timing and how much is because this is what they switched to, right? So in my
Mhm.
first 5 years, my cleft repairs probably are not as good as my next 5 years, and so
Mm.
so then like, is it better just because everyone's more experienced? I talked with our anesthesiologist about it. I mean, they're comfortable doing it. I would tell families if they want to do it sooner, we can. The key is that the child is gaining weight, right? Because everybody loses weight, and cleft affected babies tend to lose more weight and take longer to get back to baseline. So you want to make sure that you're not going to do the surgery and then put them even further behind. And so you want to make sure they're gaining weight, they're feeding well, and then we can do the surgery sooner. But there's no real rush, I don't think, because that might be part of my bias, right? We talked about like probably one of my superpowers would be I genuinely like enjoy and love seeing people, no matter what they look like, whether they have clefts. It's it's terrible. There are some surgeons out there that will say very kind of unkind and nasty things to patients that kind of pick at insecurities, and it's one of those situations where like the things that you really feel strongly about that you don't like, it kind of helps define like what you're about and what you're
Mm.
for. And I'm so much for like inclusivity, for kind of genuinely and authentically loving. Like, you can have the biggest craniofacial difference, but man, like some of our most joyous and most powerful and most like just spiritually uplifting patients have the most severe differences, but man, are they so
Mhm.
much fun to be around, and they're just like a literal, like you walk into a room and they are lighting up the room.
Mm.
So
Yeah.
that's probably the big question for me is how do we get more people to live and feel like that? You know what I mean?
Yeah.
Uh,
Mhm.
I have literal like models. I have people who come into the office and people are paying them money because they are so good looking and they are picking at little asymmetries, little
Mm.
like things that nobody can see. I can barely see it. But they are like so I don't say fragile, but they are beating themselves up about it. They're suffering. Like they are
Mm.
legitimately suffering. But how do you get them to a spot where they can live like these other people that are so like stable and sound and happy, and satisfied, right? Like,
Yeah. I'm glad that you mentioned that because just in reading your bio, you mentioned just cleft affected individuals into I believe you see teenagers and some
yeah,
into adulthood as well. And I always have wondered like, you know, we've had people come on the podcast that share like, well, I continued to see my surgeon every year because I don't know, even if I don't need anything, because I don't know when I will. And I don't want to break that care.
oh,
And then I've also heard people that kind of like struggled with finding an adult
oh,
that like a cleft surgeon that can see them as an adult.
yeah,
And so, what does that look like? Like, do you? I mean, you continue to see them after in their teenage years, but can like an adult come and see you as a cleft
yeah.
surgeon?
It's hard. I think some setups. So I had a children's hospital that tried to bring me in, and we talked about it, but they didn't have a mechanism to let me continue seeing adults. And so it's not just like somebody you would think of, 40, 50, 60, but even we have people who are not done growing. Say your jaw is still growing and you need a jaw surgery. You don't want to do it before you're done growing because you don't want to do it and then have to do another surgery when you're
Hmm.
3 years older. So like some people are like 21, 23, and then they're done growing. So then we do the jaw surgery and the rhinoplasty, that sort of thing. And then sometimes we have people that are just tired of surgery, right? Like some people end up having
Mm.
5, 6, they have to do a redo bone graft. They have to do all these things. We have people coming from different places who say, I've had 17 surgeries. I had a lady who came in that she said she had like 50 something surgeries. And
Mm.
so at some point they just said, I'm done. Like I'm tired.
Hmm.
I don't want to miss, I don't want to miss this soccer season. I don't want to miss this particular trip to Europe. I just need a rest. And so then people come later on. So we have I know we had somebody who came, I think he was in his 60s, and he still had some speech problems. So we actually worked on his palate. He was very thankful for that. We have people who come in when in their like 40s and 50s doing rhinoplasties. I'd say a big part of that is people who have problems breathing. Like a lot of people have deviated septums and they have problems breathing, and then people with especially like a unilateral cleft. I say that septum right in the middle, it's kind of like a boat getting caught in a river kind of sideways,
Mm.
where a lot of times the front is pulled off to one side and then the back pulls off to the other side. So you get this terrible blockage. And then ENTs, a lot of times they're like, oh, you really should go see somebody who does works with people with clefts. And so then they end up with me, and then we get them breathing better, and then it's up to them. So sometimes I say we work under the hood, and we just get you breathing better, and everything looks the same. Sometimes we do everything towards the surface, so you can see a difference too. For a lot of people, just getting a little bit more symmetry, is a good boost to the confidence, and it can help the breathing. So there's different spots
Mm.
where your nose gets blocked up, and so I don't say fixing. I don't like that word, but just making that part stronger, that part of the nose stronger, keeps it from collapsing, and so people can sleep better, they can breathe better, they have more energy. It's good for blood pressure and
Yeah.
all health.
Is that common, a deviated septum?
Yeah, I think it's like 30% of the population. When people have just gone globally and they've looked around, like one of the most popular surgeries every year, probably hundreds of thousands of people every year have rhinoplasties, septoplasties, because it is super duper common. And I'd say for people with a unilateral cleft, it's going to be like 90, 95%.
Mm.
Just because anatomically there's differences in how the muscles pull on the septum. There's differences in because of the cleft, instead of going right down the middle, a lot of times that palate and the spine where the septum is gets pulled off to the side. So it can just it can be something where people don't know until we open up the airway and they say, oh wow, like I've never felt air, hit that part of my, throat before, because they just always live.
Yeah.
Yeah.
I've always been curious about that because of Giselle. So I'm waiting, right? Because that's what we
Yep.
do. Wait till she gets a little bit older to
Always.
see if she's having, because she is having some breathing issues, but I don't know what it is. And she's only 2, so
Yeah.
we've only had a few, no, I take that back. We've had a lot of appointments, but but she's, we see the ENT like whenever we see her, right? Like for
Right.
our check-ins and stuff. But it's definitely something that I want to continue to
Yeah.
bring up because it does seem like something that she struggles with in particular.
And so,
Um,
and kids who are born with clefts are also still like normal kids. So a lot of kids end up getting ear tubes. A lot of kids have tonsils and adenoids and things like that that need to be looked at and sometimes treated. So there's a chance, it's like at some point she might need her tonsils out. Usually, if that needs to happen, we talk with the ENTs depending on the palate, the speech. Maybe you take off a little bit less. Uh, but I would say, with the cleft palate, without, um, I mean, I haven't looked inside your daughter's mouth, but if things were more in the middle, then I would say the chances of her having, some sort of blockage are probably close to sort of like the baseline. Like most people, 20-30% might have some blockages,
mm,
but probably no higher than
yeah.
anybody else. Yeah.
Yeah, it's so funny. Her ENT is very she's been an ENT for a long time. She's very old school and she's like she straight up told me, she's like, "Do not let anyone touch her adenoids yet. Like, wait." Like, because she's like, "You wanna wait until her speech develops. Don't let anyone try to touch her adenoids or her tonsils. We'll take a look at it when the time gets there."
I'd
And
say the
I'm
same thing. Yeah.
like, "Okay." But, and just bringing it back to like babies, what you mentioned about, so do you do outpatient for lip, or is that just something that
We
is
offer it. So,
you offer?
um, yeah, I tell people I'm never gonna kick you out to the curb. Like, I'm never gonna wheel you out before you're ready to go. So we make sure that everybody is, 1, safe to go home, right? So you're feeding, you're drinking, pain's okay, like, you're doing well enough that I'm not worried any more than I usually am about you having to come back, to the hospital for any reason. But then 2, yeah, I want parents to be comfortable, right? You have to be ready with the pain and the feeding and all those things. So we can do it, and I usually offer it, but then it's probably less than it was during COVID. I think most parents, because we have parents too that come in from out of town, and
Mm,
so it's easier for them to stay overnight. I think it gives them some comfort that there are nurses that know what's normal, right? They know what to expect after surgery, and so they can help the parents that first night. So I'd say most people feel more comfortable staying that night, but some people, live in town. They really want to get home. Maybe they have other young kids at home. And that goes both ways. Sometimes people have young kids at home. They're like, no, we really
we know.
need to be in the hospital.
Yeah.
Yeah.
Yeah, that happens, I think, because their kids are maybe like rambunctious or they have
Yeah.
to, yeah, like the kids at home are too much to deal with. But I've heard that as well. Like people talk about that, like, oh, we were sent home the same day. And it's like, wow, really? I didn't know that they did that. But what I have learned as well is like COVID allowed us to realize like, hey, we can do things more efficiently, right? Like more, if it's safe, as long as it's
Yeah.
safe, then things can be done in a shorter time spans. What is the healing process for lip repair? Like when should people, or what does that look like? Like, do you use the nasal stents and all of that stuff with your repairs? I know some doctors again do it differently. They have different
That's a
methods.
different, I know. I'd say healing after the lip repair. There's even like the prep. So I know you've talked with folks about like NAM before, and that's a point of stress because we do have people that come from 6, 8, 10 hours away, and so then like how do you get to and from, and like is it even worth it? You know,
That's the main question.
yeah, yeah, and sometimes it is, sometimes it isn't. That gets back to the annoying, like everyone's all different. But I would say healing wise, right? Usually, for me, I use mostly absorbable stitches. I will have one stitch in the nose stent to make sure it really stays, where we have it. But everything else is absorbable. Sometimes some skin glue, and then it's like any other incision. There's a curve. I'll show you later, but there's like an S-shaped curve where there's new scar tissue and it's there, but it's not strong yet. And then over the course of about 6 weeks, you get up towards like an 80-85% strength. So there's a whole like scar maturation process that happens where you get a new scar. It takes, call it, a month to get to 50%, 6 weeks to get 85%, and then you have to deal with kind of like maturing the scar. And how do you deal with
Mm.
massage and with SPF and silicone and all these things? And I would say so much of it, when you look at it, is genetics, right? So people with more color, so I'd say Asians, Hispanics, African Americans tend to have thicker, darker skin, thicker, darker scars, and so sometimes those just take longer. I don't
Mm.
know about you, but like I had a cut on my knee, which took, I don't know, it healed up fast, but that scar was there for, gosh, like 2.5, 3 years at least, and it just took a while
Mhm.
for it to soften up and fade. And so that's part of it, is just everyone's going to heal a little bit differently. We all do the best we can. We do these little things to help, but then at the end of the day, so much of it's just time. A lot of scars take 6 months to a year to really mature, and then sometimes if we're there doing a palate repair, and we look at the scar and say, it's there's something we can do for it. Sometimes we'd put in a little bit of a steroid injection. Sometimes you might touch up the scar a little bit, but you maybe wouldn't have done it otherwise. But if you're
Mm.
already there, maybe we'd do a little something. Uh,
Yeah. So do you offer all of those things, like the
oh yeah,
shot and the
we do.
nasal stents, and
Yeah,
and do you well, you kind of already answered this, but the NAM, you
yeah.
um recommend that your patients use the NAM?
Yeah, we have in our office. So we have orthodontists, but then we also have somebody in our office who was in an orthodontist office for about 10 years. And so that's one of her passions actually, is NAM, and doing the NAM and also the nasal kind of reshaping part. So
Mm.
we offer, I'd say, everything from those prenatal testings, prenatal conversations really, up through the lip, palate, speech surgery, bone graft, jaw surgery, rhinoplasty. We sort of do it. We do it all, all through this hospital and through this office. We'll go to some other hospitals too. We do our best to be on as many insurance plans and as many different facilities, try to help everybody out. But yeah, we kind of do all of it. And I think one of the cool things about it is, yeah, we do take care of adults, and we take care of people who have been in this practice. So I told you that there was this woman that came in. She was seen by predecessor from 50 years ago, went through all these surgeries, skipped probably 30 years, and then came back. And so we have a lot of people who are 20, 30, 40 years old too, that just, you get to see the long term effects of what you do. I think that's one of the hard parts about cleft surgery, right? Is you do something and it might look good right now, but call it in 15 years,
Mm.
once grown, you say, oh, that caused this extra bit of scar here. Like, was it necessary? And so if you change it 15, 20 years later, you got like one shot. And then in another 20 years, man, you're done. Like if you're still around, you're retired.
Well,
So
do you tell your patient that? Do you like, or do you, I mean, you probably don't phrase it like that, but
no, I
like,
don't.
do you say, hey, do you make suggestions like that?
It
I mean, you make
I
recommendations,
open
right?
up the conversation, right?
Yeah.
I I I really don't like to introduce any new,
Mm.
like,
Mhm.
areas of concern. So if people have something, like a scar or an asymmetry or something like that, yeah, it's a question of, like, does it bother you? Because if it doesn't bother you, um, then I can make it different, but are you gonna live your life any better, any differently? Or am I just gonna like put you through a surgery? You're gonna have time off of work, recovery. Yeah, you're gonna,
Mhm.
all that stuff. So yeah, it's I try not to introduce anything new. I would say like sometimes if people ask and open it up, then I'd say, well, this can be, done differently. Like some people have, say, like the lip. The muscles really form a ring like this, and so sometimes the muscle is more like this, where it's kind of peaked up like a mountain, and so you can see that
Mhm.
notch, and it's causing either like cracked, dried red part of the lip because that's outside, or they're having a hard time like sucking on straws or keeping food in their mouth. And they might not notice it, but then you mention like, "Oh yeah, that does bother me." Like, well,
Mhm.
we could make it different, and it's a different era too. I think in the old days, the doctor would say, "You need this, this, and this. We're doing this," like end the
Mhm.
conversation. And now it's more of a partnership. There's a lot more give and take of saying, "Hey, like what does bother you?" And then here are the realistic expectations for risks, for downtime, all that stuff. And then like, do you want to do it or not? Sometimes I realize I'm not a good salesman. All right, like people come in and they almost want me to sell them surgery. I'm like, no, 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 you don't need surgery. Like you look great, or you feel great. Like don't let anyone don't let anyone touch you because you're amazing the way you are.
Yeah,
And then
yeah.
sometimes I tell people like you're amazing, but I can help you breathe better. And while
Mhm.
we're there, I can make your nose a little more symmetric if you want, or bring it up or make it a little bit smaller. There's little things we can do to remodel the nose, right? I tell people it's not like Mr. Potato Head. We don't just like take your nose and pop on a new nose. We do some reshaping with the foundation that's there, with everything that's there, and most people get it. And I would say most adults really, because you've already gone through so much of that internal
Mhm.
processing and that journey, that I think most people are just, I don't know. It seems like they're thankful just that somebody acknowledges it, and
Mhm.
like listens to them, and it like you just hear people out and say, yeah, this is something I learned from being a husband. Right? Sometimes I come home and all like my job is to put my phone down, you know, look at my wife 15 minutes and just acknowledge. Like that sounds really hard. That sucks, right? Like I think that's what a lot of when people come in the doctor's office, sometimes that's it. That's all the doctor they need is just for someone to hear them and say, "Yeah, that sucks." And like, can I help you with it? Maybe. Like here are some options. But if not, it's okay. Like I don't know. My
Yeah.
predecessor said like don't ever put yourself in a position where you have to operate to, keep the lights on or whatever. Like we do it when it makes sense, when it's the right thing to do. And then so often the best parts are when I get to see the kids back or the adults back and they're doing great. And you just get to like give them high fives. I got that 6-year-old give me like knock knock jokes and you just hang out with them and you get to see people like living their best life and you just get out of their way.
Yeah. What's the hardest surgery for you to do? I know I've find like you are very you talk a lot about the emotional aspect of it, right? Because it is, and I think just in thinking about that, what do you find most challenging, but also just I guess more just harder for you and the patient?
I say recovery wise, I'd say every single surgery has its own challenges. All right, I would say like a jaw surgery. I mean,
Mhm.
you're breaking people's like face bones and moving them around and then I know, see, like I can even see it in your face. Like, oh, it hurts. It hurts. It swells. Like we don't wire you shut, but you have rubber bands and you're swollen.
Mm.
So it's hard to breathe through your nose. You can't open your teeth all the way. And so you're just
Mm.
kind of that swollen, miserable feeling, at least for a week. Even if, surgery is short, the recovery is great. Like it's still like you're on a liquid diet. That's a hard one in that way. Right. And then like the bone graft is hard because like it doesn't hurt. Like you don't feel bad. People go home same day, tiny incision, like kids do great, but then we keep them out of sports. We keep on a liquid diet. So the kids feel great, but then you're taking these 7, 8, 9-year-olds out of PE. You're kind of setting them aside from their classmates. They're having to not eat their normal foods. So that like emotion, I think, is really hard.
Yeah.
So,
Do you take bone from the hip?
mhm.
Are you okay? Because I've heard of different methods now.
Yeah.
What is it, like cadaver bone or something like that
Yeah,
that they're
that's an option.
using? Yeah.
There's cadaver bone. There's your own bone. There's a lot of different places we can get bone. Traditionally, the hip's a good spot. Usually, we can make an incision that's about less than an inch. You just kind of get down, and I don't know how much detail your listeners want to hear.
All the surgeons say that. They go, how much do you want me to
How
go
much
into
detail do you want? Yeah, because this is about the time when some families are like, oh, like that's it. So you
Well,
gotta,
I will share this with you, and maybe it's something you knew or you didn't know, but every single cleft affected individual that I have had on the podcast, I tend to ask them, what is the first surgery that you remember?
yeah.
And it is bone graft. Everyone has said the first surgery I remember having was bone graft, and I just remember waking up and being in pain in two places.
Oh,
That is like
great.
here, and it's like, and it's a lot of questioning because they're still fairly young, right? Like 8 years
Yeah,
old. Were you
between 7
doing?
and 9, and then
Yeah.
yeah, but I mean, I have an 8-year-old, so I get it. Like they
Yeah.
understand a lot, but there's still a lot that I don't know that yeah, I could see how it'd be hard to understand.
Mhm.
So we do spend a lot of time before the surgery, kind of counts like talking with the kids, telling them why it's important. I've taken to saying, that the teeth have roots, just like the trees
Mhm.
outside. And so at some point when you're, trying to straighten out your teeth and you want to put a tooth in that space, if you tried to put it in that space, it would just fall out, just like a tree
Yeah.
would fall over. And so we have to add a little bit of bone in there so it can be strong, like to last the rest of your life. And so I think kids get it, and I think that age, kids can really get anxious and get in that cycle. I don't know if you've kind of. I remember my nephew once. He like stepped on a sea urchin, I think, right around that age, and he got really anxious. And then I see it in the ER with kids who need stitches, and then they start hyperventilating, and the more anxious they get, then they start thinking about the worst case, like
Mm.
gonna die,
Yeah.
and then you're trying to come towards them with something to numb them up, and they're just like
Mhm.
can't have it. So there's a little bit of prep work I think that goes into kind of like reminding the kids that, hey, like we're not doing the surgery today. You're going to know about it, right? We're going to tell you, and you're going to know weeks and months in advance. Okay, here's everything that you can expect. And then I try to remind them, like, you don't have to have all the questions right now. When you think of
Mm.
stuff later on, you text, you call, you email. We get letters. We actually have patients that
Mm.
will write letters to Miss Monica, who's our speech therapist, asking about what they can eat
Mm.
after surgery. And so I think there's that prep process, so that by the day of surgery, like they should be at peace with it. They should understand it. They might not like it, right? It's like taking away an iPad. It's like you might not like it, but you understand why. And so
Yeah.
like we're going to be taking away some of these foods you like. Uh, but this is why we do it. It's for you. It's because we love you and we want what's best for you. And then afterwards, we'll get you back to like with doing everything you want, eating what you want. So I think
Yeah.
once they can process that. Like I would never want to spring it on a kid, and then all of a sudden, you're in the hospital, and then, yeah, I would hate to wake up and like not know like why do I
Yeah,
like
they just
yeah
I mean, I guess, they're older, so I'm thinking back, like, there's memories that I have from back when I was 8, but it's still kind of a blur, but I think that I think it's probably like one of those I remember that day, like,
yes yeah
that's
those core
the
memories
yeah,
yeah
and of course, lip and palate, there's research on, like, the body remembers, right? Because I think one of the things that we tell ourselves as, like, relief as mothers is like, well, they won't remember. Like, we try to tell ourselves that, but I think that's why I always ask that question, like, what is the first surgery that you remember having?
yeah
Because
yeah.
obviously lip and palate is yeah, and it's always that bone graft is a major
Yeah,
one.
it makes me think of two things. One is, we do have longer acting numbing medicine now. So we have some
Mm,
things that can really help smooth out those first couple of days when it's usually the worst. And then two is I have had some patients that say that they have gone to like PTSD specific
mhm.
therapists to process, these sorts of traumas. Essentially, it is trauma, right? Like someone
Mhm.
surgery is like controlled trauma. Like we are doing something um, like to somebody. We're doing it for them, but it is something that is happening, physiologically and psychologically, and it's a very like profound kind of thing. So I think we covered a lot in medical school training and everything that it's a very sacred like trust, and so we try to honor that. But it's really hard. There's no minor surgery. Like it could be a 5-minute surgery that for us we're doing 10 little mole removals, but for you, like for whoever is having it done, like it is a major kind of milestone and step, and it could be the most important day of their life. So
Yeah.
like you kind of have to keep that in mind when you get bogged down in the day to day. You're like, oh wait, like this is so important.
Yeah.
Yeah.
Yeah, I agree. You've documented a lot of your education and your journey and your experience online. What made you start doing that?
Um, you know, initially it was wanting to put some before and afters, right? From a very selfish standpoint, you want to make yourself available. So when people say, that, you know, I have that same problem, right? I want somebody who knows how to do a cleft rhinoplasty. Then we could have some of those up there. But I would say over time, it's turned into more and more about the education, right? Because I think people find us. We have patients from Europe and Asia.
Mm.
Kind of all over. People will come see us. So it's less about that now, and I think it's a lot more about the empowerment, right? So the more that people understand, both surgeons and patients, but the more people understand, then the better decisions you can make, and the more comfortable you are as a parent that you're making the right decision, right? So much of it is you just want to know that you are seeing the right people, the right things are happening at the right time, and that's all you can do, right? If things don't turn out exactly perfectly the way you dreamed about it, at least you're at peace with I did everything I could, right? So I think part of it is just giving people those tools so that they can make the best decision for themselves and their families. I actually spent a year at the CDC. So
Mhm.
I thought I was going to do pediatrics, public health, and I was going to impact the world in these big ways, help millions of people at a time. But it turns out like I like people. Like I don't
Mhm.
like spreadsheets. I mean, spreadsheets are my friend, right? But I don't want to spend all day on a spreadsheet. And so I really liked the impact of individual people. But now I think about it and I think, I'm having the same conversation. I'm having literally like the same conversation in every one of these rooms, 5, 10 times a day, every day. Like, what if we put it out there? We had a surgeon actually who does a lot of breast augmentations. And so he actually has his staff call the patients the day before, and they give them like a full rundown of, here's what to expect, here's some education, here's all these things, so that by the time they get to him, like the baseline information is sort of already there, or there's at least a foundation there. So when they come in, he doesn't go through that again. Now it's the kind of second level stuff. It's, what's unique about you?
Mm.
What is the thing that will give you the best possible, outcome, the right decision for you, rather than here's the general information for everyone.
Mhm.
So I found that helpful is that when patients come in, a lot of times they've already read and watched videos and already sort of set themselves up. And if they haven't, it's okay. Like that's probably one of the other main things I tell people is like, don't feel like you have to remember everything or know
Mm.
everything. You don't have to leave here feeling comfortable, but definitely I want you to get there. And so part of it is, I'm available. You come back as many times as you need, but we also have these resources, right? So then you can look into that. And then as you have questions, you contact us and we help you get to that point. And so
Yeah.
it's, a lot of that's that education. And you know what? I'm gonna put it out there. I read a book, I'd say last month. All right, it was recommended to me by somebody, and it's written by a Navy SEAL, and it's called Unstoppable Mindset. Okay, it's one of those. I usually go like fiction, nonfiction, fiction, nonfiction, and so this is my nonfiction book, and it was a very uncomfortable thing at the end of chapter like 1 or 2 where he says, "Okay, now write down your goals. What are your 1 year, 3 year, 5 year, 10 year? Like, what are your goals? You know, and so, like, kind of one of my goals was I would love to do something that helps people in such a way that they would want me on Sesame Street, right? Like, I particularly, it's not that like I want to go hang out with Elmo and Big Bird, right? But that's the kind of thing where somebody says, "Man, like they are doing something for people, for the world, like something
Yeah.
that people will connect to, and that's a message that we need more people to know about, right?"
That is a wild thing. You know what? You just made me have an epiphany because I have been trying to identify, like, what is the end goal, right? Like, what is the thing? Even with this podcast, it's like, what is the thing? Like, I want to build awareness, and I feel like I've done that fairly well, right? We still have so many things to that we can do and that we will do, but what's the like thing that I want to do? And you have like really identified that. Like, it's so wild because I don't know if like people are listening and they understand like what you mean, but I understand what you mean. It's like you want to do the thing that people want to learn about or that they should know about for the world, like to start like as a service, like and to educate. Yeah, that is put very beautifully. One thing I want to touch on as well, um, that I think is brilliant with social media. I think that so much of, Cleft can be very like sterile and feel very clinical. And like you go into these offices with these, surgeons and you kind of feel like the little person in the room, right? Like you feel like, well, I don't want to challenge, like this is the person that knows best. And I think that using social media and using your voice and your face, right? It breaks down that barrier and it creates connections between you and your patients. And it's an open invitation for someone to ask you the questions that, you as a parent, you feel like, well, I don't want to sound stupid. Like, I don't want to say the wrong word or the wrong thing. It's so funny when people come on the podcast as well. They're like, I don't know the word for that. And I'm like, I've learned a lot from a lot of parents, but I am not a cleft like expert. Like I've learned a lot, like I have, but it's taken time,
Yeah,
Um,
it's not
so
so.
there's no gotcha here.
Yeah, yeah. That I do get that feeling sometimes, right? Like people are unsure whether it's like a language barrier or like
Mm.
that yeah, that question of hierarchy, right? Like, oh, you know so much, but at the end of the day, still, I think I said it earlier. Like, I'm really there for a few hours, and then 15 minutes once a year, right? Like, this is like your life. This is your baby's life. Like, it's not about me, you know, and I'm in my 40s. I don't think you're there yet, but I feel like at some point when you hit
Almost,
your
almost.
when you hit your like kind of once you start finding your stride, right? At some point you just start worrying less about like the bad things people say, and you say like what is the right thing and the right thing for me. So what I want families to do is they need to really put themselves and their kids first. And so
Mm,
sometimes it is exactly what I would recommend. Sometimes I say like, look, this is what I would do, but because you're driving from 12 hours away, like this is how we can work it so that it's the best thing for you guys and make it the best thing for the kid, because in the end it's all about the kid. That's probably one of the best things really is when the parents, you have an active teammate, right? Like the parent is there helping the
mm,
child, and you can work together to advocate for them. And so yeah, don't ever, I don't want any parent ever anywhere to feel like they can't ask a question, right? Or
yeah,
they can't say something because they're afraid of sounding, silly or uneducated. Like it is at the end of the day, like uh, you have to understand it, um, or else you're not going to have that comfort, right? You're not going to be at that spot where you said, I did everything I could, or I fully am at peace with what is happening. You're always going to have that anxiety. And so you can't, I don't know. That gives me like the willies thinking about it, because you're at night, you're at home, you're like washing the dishes, you folding laundry and stuff, and you can't be stressed out about it. You have too many other things to stress out about. Like this is one piece. If we can help you with it, then by all means,
yeah,
like we need to fix that. We need
yeah,
like the cleft whatever is a thing, but like leading into it on the back end, all these things like we can definitely it's more than just the surgery, like by far.
yeah.
Yeah.
This is our final
Oh
question.
no, we're gonna have to do this
What
again.
had Yes, we do. I have to pick up Giselle here shortly.
Oh
But
no.
what has your journey taught you about life? What has your work taught you about life?
um my work in general, gosh,
It's such a heavy
it
question.
is, it's hard to put it down in one day. um I would go back to kind of full circle, back to the beginning, where when I have like teenagers, young adults come in, and they're looking for their way, you know, I tell them you really you find something you enjoy, or at least you can do, right, and you can do it day in day out, something that you're reasonably good at, but then really see where the world can use that, right? Because so much of it is figuring out how can I use my gifts, my strengths, and find a place where I am helping other people. Because if when people live all for themselves, it seems like they're never quite happy. But,
Mhm,
but once you start serving and helping and living for other people and lifting other people up, then that's where you really get that deep satisfaction, that deep fulfillment. My partner who passed away a few years ago in a car accident, his son was up there speaking and talking about how he found his journal. He found his journal on his desk and he looked at it, and he had a checklist of everything he wanted to accomplish, right? And he was in his 50s, but he'd checked them all off. He'd managed to get it. He lived a very full life.
mm,
And so I think there's a little bit of, at some point, we're all going to be there in the end, and like I think this has helped me figure out like what am I about, right? Who am I? What do I want my impact to be? And then it gives you that guiding post of like 10 years, 15 years, like what I'm doing. You only have so much time, right? Like between work, family, kids, all these things, you only have so much time in the day. So what am I doing with the time that I have? And is it what I want to be doing? So I'm
Mm.
guilty of that, 100%. Where you sit there, you scroll on your phone, and it's like an hour's passed by. But then when you kind of step back and say, okay, I really want to feel good about what I did today. These are the things that I want to work on. Like, you're not going to build it in a day, but I'm going to lay a brick today. And I'm going to do a brick tomorrow. I'm going to do a little bit every day. And, I'm going to look back in a year and say, I did this thing and I feel really good about it. Right. So for me, that's what the journey's been, is kind of that self-discovery of what are the guiding posts of, like, what am I about, and what am I doing, and why am I doing it? So you caught me at a
Ah.
very, like, philosophical.
Me too. I love this though. Oh, this is so great. Thank you so much, Dr. Law, for being on. Again, your willingness to just come on the show, and also just signing up right away. I didn't have to do any convincing or anything like
No. This,
I
again, this, I said yes. Like, this is exactly what I'm about. Right? Is the
yeah.
education, the community, helping families really make better decisions and live better lives. Then, yeah, all for it.
Yeah. Thank you. And thank you all for listening to the Our Forever Smiles, Cleft Mom Diaries, and Support podcast. Be sure to subscribe and submit a review of the podcast wherever you listen. I hope that you've enjoyed this audio experience. Maybe you cried a little, laughed a little, but more importantly, I hope that you feel a little piece of reassurance and even joy in your journey. Talk to you next week.
Hey everyone, it's Laura here. I'm popping in today because I need your help. If Our Forever Smiles has ever helped you, if you've learned something new, felt less alone, or found hope through this podcast, then I'm asking you to help keep it going. Creating this podcast, sharing stories, and building a space where Cleft families feel seen and supported is something that I pour my heart into. But the truth is, I cannot do it alone. If we want to reach more families and provide even more resources, we need your support. So I thought of a creative way to do this. For just $2 a month, you can help ensure this podcast keeps going strong. For $5 a month, you'll unlock exclusive Moms in Real Life content, real unfiltered conversations about motherhood and career and everything in between. And then for $10 a month, you can get everything plus exclusive merch to show your support. If this podcast has helped you and you want to see it grow to help other families that are probably facing the very same challenges that you are facing right now, please consider supporting us today. Every dollar goes toward making a difference for Cleft families just like yours. And right now, we'll be using the funds to elevate the show for production. So we'll be able to add more video and just get new equipment. And as soon as this community is established and we're able to do more, we definitely plan to go beyond the scope of just this community. We want to be able to support scholarships for new craniofacial surgeons. We want to be able to support global surgeries and just really spread our efforts to continue to make an impact in our community. I just want to thank you in advance, and I'm just so grateful that you all are able to support me and support this community here. And it's definitely something that I'm really looking forward to. The link is in the show notes, and I just want to do a shameless plug here. The Moms in Real Life podcast is so cool, so candid, and yeah, it's definitely something that you'll want to check out. Thank you all again.